One of the things that motivated me to get into medicine is how I saw physicians come from abroad to Ghana to deliver care, and the difference they made in people's lives. When the dream sort of started, it seemed impossible. It was a concept on paper 2 years ago, but today is really to celebrate, to say we've been able to do, with your help, what we said we were going to do.
I became aware of him wanting to do something like this on the day I met him, because we just sat down and talked, and again, it was the kind of patient-doctor conversation where, he really cares about people. We're really talking about a much greater cause. We're really not just talking about building a hospital. We're talking about building communities. We're talking about building lives. We're talking about really rebuilding lives.
A year ago, about this time, we talked to you about breaking ground and putting up this 40-bed hospital with 4 operating rooms. We have private rooms. Anyone who has visited any hospital, a lot of hospitals in Africa would know that we are used to having wards. A big room with 10, 20 patients. Some people don't have even beds to sleep in, and they sleep on floors. We are not doing that here. We have individual rooms, private rooms, maybe 1 patient to a room, 2 patients to a room when we are overflowing, so we can treat people with dignity. So we have 1 operating room equipped, and then a second one, and eventually all 4. We have a 4 to 6 bed intensive care unit that, once it comes online, will allow us to provide high-end intensive care to our post-surgical patients.
Even that vision would be hard for some people to grasp, but the fact that that's going to happen, I think it's just kind of incredible.
Right now, as we are speaking, we have equipment on ships sailing towards Accra to equip the hospital. We don't have everything that we need, but we're going to start with the basics. The hospital is going to have, hopefully, with your help, state-of-the-art lab. Currently, in Ghana and in the West African region, if you need a sophisticated blood test or laboratory test, the sample is taken, it's either shipped to South Africa or India. It takes about 2 weeks to a month before you get these critical results and then have medical decisions made. So we want to be able to bridge that gap.
I just envision there are going to be so many new discoveries that are going to happen right in Ghana. There are going to be new medical discoveries that are going to happen. There are going to be so many needs for, whether it's X-ray machines, whether it's the tools and that doctors need to perform some of the surgeries and some of the medical procedures. They're going to need equipment and chairs just for people to sit in, for waiting rooms. They're going to need clothing, and they're going to need uniforms. But if there is any organization that can donate, again, to a hospital some of these major needs, I'm just making a plea to dig deep.
We really want to have solar energy run the place, so we won't have to divert resources to find energy locally. It's also very expensive, so we can focus our resources on direct patient care and training. So anyone who can help with that, it will be very welcome. One of the other things that we want to focus on is really having funds that we can really support patients who have absolutely no means to have care. And also help with the work in Ghana. You should definitely reach out to us.
So this would be really a shining light for the world. I mean, and to think about it, to be, for his vision, for that hospital to be in Ghana. I mean, for some people, the fact that you could have an exemplary teaching hospital where doctors around the world would come to be in Africa. I really am emotional about this. I just can't believe it's happened like this.
Here we are in Accra, Ghana. This is the hospital. It's amazing. Lives are going to be changed and saved here. just arrived in Ghana today, 10-hour flight from Dulles Airport. Look at this. It's unbelievable. There's Dr. Boahene in the background. We're here to inspect and walk through the hospital, and just lovely, absolutely lovely. The extends all the way to the palm trees. All this will be cleared out once the construction is almost completed. And there's Dr. Boahene. Nice. Grass is really nice. Very nice. So we're going around the back here. Around the back. Grass is very lush. Amazing. Wow. And this construction took literally 2 years, just 2 years. 2 years. They were done. Just doing finishing touches and everything now. These are water tanks back here. Really nice. Wow. This is the entry, right, for, there's a ramp that goes up into the hospital. Here we are at WAISS, Foundation for Special Surgeries Hospital, where lives are going to be saved and changed. It's really amazing. How many air conditioning units do we have there? A lot, I see. Wow. Very nice. That's great. This.